So when it comes to tight lower back, tight hips, even lower back pain, you definitely want to start with some seated Kegel, reverse Kegel breathing. As you can see in the diagram, the muscles kind of they're like slings in the pelvic floor. When it comes to the breathing, of course, the exhalation, you want to contract everything, pull everything up like you're trying to not use the restroom. And then you want to relax, inhale and not inhale into the body. Try to keep the stomach in and let the air come through to the pelvic floor. That's why I have my hand down there so I can get some tactile feedback. So I'm trying to breathe into my hand to get that pelvic floor moving. And this is a different variation. You definitely want to challenge different positions of doing this breathing. So here I'm just in the 90-90 positions, hand still on the pelvic floor getting feedback. It might not move at first, but keep going and you'll find the activation. Now we're going to get into a lateral hip series. This is pretty simple movements, just lateral hip raises for 20. Then we'll go into small circles, the legs completely flexed, straight, no knee bending, going in both ways with the circles. Then I go into bicycles. So as you can see, just riding a bicycle, going forward, going back, 10 for each direction. You're probably catching some burn here, but keep going. This is where the growth is. You want to burn. You want to feel the burning. You want to push through that. I would try to keep cool. Stay calm under the pressure of that burn. And of course, here we have some zigzags. This is probably the hardest part. Next up, we're going to go into some hip drop downs, also known as hip swivels and axles. So I got the knee out at an angle, and I'm going to walk towards that leg that's straight out, so like in that direction. So I kind of curve out. So I'm walking out, drop the hips to the floor, and then I'll walk back out, drop the hips as far as you can, and then walk back. And here I'm just kind of sitting on the heel, the back foot, and I'm just going to rotate externally and internally, rotate that foot, and you'll feel it in the inner leg there working. This next one's pretty challenging. There's some regressions we can get into, but these are adductor lifts, so we're working the inside of the leg. Big emphasis on pushing through the inside of that foot that's connected to the ground. So the bottom leg is bent. So I'm really pushing through that extended leg on the inside of the foot, keeping the whole leg engaged. So here I should be going to, I keep the knee down as I push up. That's a regression, or you can use your hand to push yourself up. But eventually you want to work where see how my head is kind of rounded forward? Eventually you want to get that up so you're looking kind of like you're in a side plank position. Then we'll go right into some standing hip circles, really getting the outside of that glute fired up, outside of the hip. So I'm going forward and backwards. Make sure you're hitting both, and forward and back, both of them are 1 rep. So you're going to go for 10 each side. Now we're getting into some plank position shoulder taps. So big piece here, wide stance and squeeze your glutes. That is the most important part. You're integrating your core and the hips together. So this is what you want to avoid. That hip shifting back and forth, the hips up to the ceiling. You want to tuck your pelvis in and squeeze your glutes the entire time. You want to avoid this shift. Keep strong, sturdy plank, full body activation, especially in the core and hips. Now we have some standing split good mornings. So I'm taking a wide stance and I'm hinging at my hips. I'm trying not to bend my knees. You can have something at a lower level in front of you. You can ease yourself down. Eventually you want to work yourself to the floor. But a big thing, see that rounded spine? You want to avoid that. And you want to keep the spine as straight as you can as you work your way down. Next up, one of my favorite go-tos is the couch stretch pulses. So you're going to have the back leg pinned up on something. Eventually you want to work your way to a flush wall, like flush against the wall. So the major piece here is squeeze the glute, lift the pelvis, relax. Squeeze the glute, lift the pelvis, relax. And you're just going to go in and out of that. Find the stretch, find what feels good, and breathe into it.